Aphasia is when a person is unable to communicate properly. Aphasia means not only when a person is unable to speak clearly, but also when they have problems understanding. We will talk about the top 7 causes of aphasia and their treatment.
The most common sign of aphasia is difficulty finding words. Almost all people with aphasia experience this symptom. They are unable to recall names of everyday objects, places, or people. For example, while trying to ask for a spoon, could you pass me the thing you eat soup with? This sign is called anomia.
The second most common symptom is using incorrect words or sounds. It occurs in around 8 out of 10 cases. For example, a person might say tephelone instead of telephone or writing instead of pen. This sign is called paraphasia. The third most common sign is agrammatism, which means difficulty constructing grammatically correct sentences. For example, instead of saying, I am going to the store, a person might say, go store. This is called telegraphic speech, where a person uses only short important words. The fourth most common sign is non-fluent speech. This means the person speaks slowly and with effort, often with long pauses. The fifth most common sign is difficulty understanding spoken language. This happens in about 6 out of 10 cases. For example, when asked, can you turn off the light? The person might not understand and fail to respond appropriately.
Sometimes the person may also create new words. For example, they might say plenty instead of pencil. The new word might sound similar, but is meaningless in context. Or on a rainy day, the person might say, I took my frigid to work. In this case, frigid is a completely new word that means umbrella. The first and most common cause of aphasia is stroke. It is responsible for around 4 out of 10 cases of aphasia. Stroke happens due to a blood clot or rupture in a brain blood vessel, leading to damage in areas like Broca's area or Wernicke's area. During a stroke, the person commonly has difficulty speaking and understanding spoken language. Almost all the signs mentioned above can be present. Broca's aphasia occurs when the inferior frontal gyrus of the left hemisphere is damaged. The hallmark sign is that the person speaks in labored and telegraphic speech.
For example, they might say, see doctor, go home instead of I saw the doctor, and then I went home. The person usually understands most language, but has difficulty understanding complex sentences. Other signs of Broca's area damage can include right-sided weakness or paralysis. Prognosis is generally good. Almost 7 out of 10 people show significant recovery with therapy within 1 year. Prognosis is better because comprehension remains intact. Wernicke's aphasia happens when the posterior superior temporal gyrus is damaged. Speech is fluent but nonsensical, with frequent paraphasias or neologisms. They substitute words frequently and create new words. This test usually does not realize that their speech is meaningless because their ability to monitor their own language is also impaired. They might even get frustrated when others do not understand them. For example, a person might say, the apple ran to the table and it laughed at me instead of I ate an apple at the table. Comprehension is also compromised. They are unable to follow even simple instructions. A right-sided visual field deficit is also common.
So while Broca's aphasia suggests motor impairments, Wernicke's aphasia might indicate visual deficits, such as loss of vision in the upper right quadrant. They might bump into objects on their right side or miss visual cues, further complicating communication. Additionally, psychiatric symptoms such agitation may appear. Their behavior might resemble mania or schizophrenia. They can become angry, agitated, or even suspicious. But these behaviors happen due to language understanding problems, not because of psychosis. Speech therapy is crucial for treatment in any stroke-caused aphasia. Medications like donepezil may help with cognitive recovery. In Wernicke's aphasia, prognosis is poor as comprehension deficits are harder to rehabilitate. Approximately 30 to 40% of individuals show partial recovery with intensive therapy. The second most common cause of aphasia is traumatic brain injury, especially in the younger population. Critical damage to neurons due to trauma, swelling, or brain movement is the main mechanism. It is commonly caused by car accidents or sports injuries. When the frontal lobe is damaged, it can resemble Broca's aphasia. When the temporal lobe is damaged, it causes impaired comprehension, similar to Wernicke's aphasia.
Fortunately, most cases recover within the first 12 months with treatment. In severe cases, recovery occurs in about half of the cases with therapy. Speech therapy and cognitive rehabilitation are the treatments. Neurostimulants like methylphenidate can improve attention and focus, and antidepressants may help if emotional instability hinders progress. The third most common cause is Alzheimer's disease or other neurodegenerative diseases like frontotemporal dementia or primary progressive aphasia. These conditions are more common in older adults, causing a gradual loss of neurons and leading to language problems over time. During Alzheimer's disease, aphasia is not an early sign. Memory problems are more common initially, and language issues develop over years. In the case of primary progressive aphasia, language problems are the earliest sign, appearing in isolation for 1 to 2 years before other cognitive symptoms emerge. The fourth most common cause of aphasia is brain tumors, responsible for about 10 out of 100 cases of aphasia. A tumor can compress and damage areas of the brain responsible for processing and producing language. For example, a person with a tumor in the left temporal lobe struggles to comprehend conversations. The fifth most common cause is brain infections such as encephalitis, meningitis, or abscesses. Severe infections cause swelling in the brain, which affects speech and comprehension. Brain infections are usually very severe and symptoms progress quickly.
Fever and neck stiffness, confusion, lethargy, or agitation, along with language deficits. Elevated infection markers in blood tests, seizures and vomiting in encephalitis. Neck stiffness and photophobia in meningitis. Prognosis is good in most cases if treatment is received early, especially in the younger population. If untreated or if treatment is delayed, mortality rates can exceed 30 to 50 out of 100 cases, which indicates a very dangerous outcome. Survivors often face permanent language deficits or cognitive disabilities. In children, aphasia is usually caused by language delay or autism spectrum disorder.
Language delay is a condition where children have significant difficulty acquiring and using language despite normal intelligence, hearing, and opportunities for learning. It affects about 7 to 10 out of 100 children. Such children start talking late, usually after 2 years. They usually say short or simplified sentences such as want cookie instead of I want a cookie. They have difficulties with grammar, limited vocabulary, and struggle to learn new words or understand abstract language. They may also find it difficult to follow conversations, answer questions, or tell stories. Language delay usually happens due to genetics, limited language exposure, or insufficient stimulation during early development. Prematurity, low birth weight, or minor brain injuries may also increase the risk.
For example, a 5-year-old may struggle to construct complete sentences and rely on gestures to express needs, despite excelling in visual puzzles. From 2 to 4 years, if treated, prognosis is excellent. 6 years, children may gain vocabulary and sentence structure but might still struggle with advanced grammar. From 7 years and older, difficulties often persist, though therapy can improve functional communication and academic performance. If left untreated, the majority of children will face speaking difficulties into adulthood. Treatment includes speech-language therapy, parental involvement, encouraging daily conversations and reading aloud, apps and games designed to build language skills. Good prognosis markers include when late talkers start using words and phrases by age 3. High nonverbal IQ with strong problem solving or visual spatial ability, a supportive environment with exposure to rich language at home or school. Good social engagement with a willingness to interact and imitate others.